with a friend back home. I came here 1 year sooner, earlier, and he got accepted. And then my dad's son called me, and then one of my friend is coming there. Can you rent a room for him or help him pick him up? I said okay. And I didn't have a car that day. I just took a taxi, go to LAX, pick him up.
Right.
Yeah, and come back, rent a room for him. He stayed, got a green card, and then he came back. And then after 6 months, he came back here.
Oh, so
and then asked me, to be friend. I said okay.
All right. Just, okay, I'll be a friend.
Yeah. Yes.
That's easy, huh?
Yeah.
You just pick up guys that easy. Just say that's where you pick them up. Okay, will you be my friend? Okay, now we date. Wow.
Everything is easy. This school is not easy.
Oh.
They're complicated.
This class in general.
Yeah.
Hey, I'm not drunk this morning. If you see me falling a little bit,
That's good to know.
but I, people get vertigo once in a while.
Oh.
So I had some episodes of it. I haven't had it for a couple of weeks, but I had it last night again. And so if you see me walking, you'll see me going like this, but hopefully it'll be over if I
Wait,
fall.
what is it?
You know, vertigo is you get dizziness, and quite a few people have it when the first episode I had was 6 months ago. I ended up in the emergency room, and I thought I had a stroke, but I didn't. But what it is in our inner ear, calcium breaks off and floats in the liquid, and you lose you feel car sick, like I feel like I'm car sick. And hopefully it goes away. And how you get it, what sets it off, is when you're sleeping at night, and it always says, and if you turn over real fast, it's like you're sleeping on your back and you want to sleep on your stomach. If you do it real fast, it seems to, I don't know, these things float in your ear, and then that's what sets it off. I haven't had it for a couple of months, but I did get a little bit of it last night. So, when I first got up this morning, I'm going like that, but it's going away. I don't feel bad now. But if you see me like coming down the hall, I thought, oh man, I'm going like this.
So it doesn't hurt like a migraine or anything?
No, you don't have anything like that.
Okay.
You just
You
feel
just feel dizzy.
you feel car sick.
Oh no.
You feel
Hate that
car sick.
feeling.
Yeah, it's you feel like sometimes you throw up. Sometimes, I mean, I'm not nauseated. I just feel car sick. So that's why if I feel like I go get something, I'm hanging on to something. And hopefully in an hour or two, it'll be gone. It may not happen again for a couple of months. It just comes in. It's a pain. It's really a pain. I mean, you don't, and I don't understand what lying down does to it. So I'm not drunk. Okay, you have questions? So this time you studied
The soft tissue
soft tissue.
lesions.
Okay,
Yeah.
do you have any questions on soft tissue? Okay, what are 3 lesions on the gingival tissue that you would include in a differential diagnosis that somewhat look all the same?
Pyogenic granuloma.
Okay.
Peripheral ossifying.
And a what?
Peripheral ossifying.
Fibroma.
Fibroma.
And there's one more.
Giant.
Peripheral giant cell. Okay, of those, what one's the most common?
Pyogenic.
Yeah, by far.
Yeah.
How would you tell the difference looking at them?
I think maybe the shape and color of them.
Color has to do with some, and why? Color, one is more red, hemorrhagic than others, usually.
That's pyogenic.
And that's pyogenic, because they're very vascular.
Uh-huh.
What causes a pyogenic kind of? What's the etiology?
I think sometimes it's more common in females
Yes.
because they might be pregnant.
Right.
So the
and
hormones.
the hormones
yeah.
change, right? And so it reacts more. Right.
Yeah.
So another name for it is pregnancy tumor.
Tumor.
Oh.
And they grow fairly fast.
Okay.
Yeah,
Yeah.
really fast.
Like over a couple months, or
Yes, they can. Some of them, I'll show you one today, can grow pretty good size. Now, of those three, pyogenic granuloma is the most common.
Yeah.
All right, it's usually the redder one. All right.
Mhm.
Of those three, two of them only occur on the gingiva. The other ones can occur other areas. Which are the two that only occur on the gingiva?
I'm guessing pyogenic.
Pyogenic can grow other areas. Not very common, but it
Ossified,
can.
and the other one
You can,
they're
yeah.
huge.
Okay.
Peripheral giant cell and the peripheral
ossified.
peripheral fibroma only grow on the gingiva because the etiology, they probably start from the connective tissue.
Yeah.
I mean, from the periodontal ligament. They come from the periodontal ligament. Okay, so yeah. Now, the peripheral giant cell can be aggressive. It can move teeth around and things like that. Now, the only way you can tell the difference sometimes at biopsy, you have a pretty good idea what they look like, but not always.
Yeah.
I have one picture I'm going to show you today, and usually ask the class, okay, give me your differential diagnosis in order you think it is. Well, usually about 90% of the people are wrong, and I agree with what they're saying, but when you biopsy it, it turned out to be
Something else.
yeah. So you can't. Oh, you have somewhat of an idea, but you can't tell. Okay, tell me about what is a common lesion in the mouth that's just an elevated, round, smooth bump that slowly grows, and often it can be set off by biting your cheek or something like that.
Irritation.
Irritation, very common. And they're not, and they're a reactive lesion, not a true neoplasm. And sometimes they look like a papilloma that we talked about before, but papilloma is papillary. This is smooth. And a papilloma is from squamous epithelium. Fibroma is from connective tissue. So this whole lecture is tissue from connective tissue. Okay? Then there's another one that you can have a bump on the tongue, just an elevated, often on the tongue.
Schwannoma?
A what? Well, schwannoma can too. That's not very common, but another one is not common that only occurs on the tongue. Schwannomas can be, or neurolinomas can be anywhere. What's the one that she put in this list that only occurs on the tongue?
Is it a frenal tag?
A what?
Frenal tag?
Frenal tongue?
Tag.
Neurofibroma? No.
A what?
Neurofibroma? It's not.
Neurofibroma can be anywhere.
Anywhere too.
Granular cell tumor.
Granular cell tumor.
Okay.
The granular, and they used to call it a granular cell myoblastoma. It was the old name because they used to thought it come from muscle cell. When you look at them, there's big eosinophilic cells under a microscope, but they are actually from nerve tissue, so it's a granular cell tumor. They're not real common, slow growing. They look like a fibroma or a neurolinoma, like you were saying. Okay.
So how do you differentiate that one with schwannoma?
You can't only microscopically.
Okay.
Yeah.
'Cause they.
I mean, a schwannoma or a neurolinoma. What is the name of the syndrome where you have multiple neurofibromas in your body? What's the syndrome?
Down? No.
No. A neurofibroma, when you have hereditary neurofibromatosis. And I've had patients that way. And in fact, one of the secretaries who was in dental school had neurofibromatosis. She had bumps all over her body.
Neurofibromatosis.
Yes. Von Recklinghauser's disease of the skin is called. So you can have. So now we're talking about you can have a neurofibroma. You can, and they would look like a neurolinoma or schwannoma. You can't tell the difference. A neurofibroma is neural tissue and fibrous tissue. Schwannoma is nerve tissue. Okay. Another one. Did she put another one? Did you guys talk about traumatic neuromas at all?
Yes.
Yeah. A lot of times, what sets off a traumatic neuroma?
Like what it is, or?
What sets it off? Why do you get them?
Trauma.
Trauma?
Yeah, often
maybe?
trauma, right, or a surgery, or a lot of times apicolectomy, where they go in and used to cut the root off when they do root canals. Just by cutting nerves sometimes, after a nerve is cut, it wants to proliferate. And so, and they're very painful, just to touch. You know, people complain of pain all the time, all right? What else did you guys have in this group? Name us some of the other relationships.
Lipoma.
Yeah, lipomas.
Liquid.
Lipomas are not common in the mouth, but they're the most common soft tissue you have on the body. Yeah. Now, lipomas, how would you tell the difference clinically? A lipoma could look like a fibroma. Okay, how are you going to clinically looking at it? How do you tell a fibroma? Huh?
Color.
So
Lipoma is yellow.
Yeah, often they're heavy yellow.
okay.
And they can get quite large. I mean, really large. Yeah. So what else do you have?
Neurofibroma.
Yeah, that's what we talked about. You can have single neurofibromas, or you can have neurofibromatosis, which is hereditary disease. Yeah.
So the fissuratum, something like this.
Like what?
The
Epilus
Epilus
figuratum.
fissuratum. So it's because of the denture or no?
Yes. All Epilus figuratum
Yeah.
is now what sets off a fibroma sometimes is some type of irritation. Let's say you bit your cheek and you get a little scar tissue and then it keeps growing. You keep biting and it keeps growing. Well, when you have the flange, if the denture doesn't fit right, you know, if it's that's over if you have a denture that doesn't fit right and over a short period of time, you would get an ulcer, all right?
Yes.
But if it's a chronic thing, it causes tissue to proliferate, so you get a fibroma. So Epilus figuratum is nothing but a fibroma, really. Microscopically, it's a fibroma. It's fibrous tissue. But it's a fibrous tissue, it's a fibroma that's long and elongated that sits in the vestibule because of a denture that's not fitting. All right? Sometimes they can look really nasty. They can look, I'll show you pictures, they look malignant sometimes. All right? Yeah. Yeah, so it's microscopically, it's just, and they're just fibrous tissue. And they can be ulcerated sometimes too. But I can show you Epilus figuratum, that when you look at it, you think it's malignant.
But isn't it because of the denture?
Yeah, the denture irritates. Yeah, the
So
denture
the
irritates.
other one, inflammatory papillary, that's for denture too? It's gonna be red?
Yes, in the palate.
Or
And
both
that,
of them denture?
yes,
Okay.
right. And in inflammatory papillomatosis, or what's the correct name you guys use?
Inflammatory papillary hyperplasia.
Inflammatory papillary hyperplasia. Yes, and that's by a denture that's not fitting real well, and it's often denture that people have in their mouth. They don't take it out at night, and so the whole palate looks like a raspberry patch.
Yeah.
Okay, and often it's red. Why is it red?
Irritated?
Irritation. Yeah.
But what caused the redness a lot of times? What organism?
The
Blood?
Fungus?
Yes,
Oh,
what
fungus.
type of fungus?
Candida?
Candida. So a lot of these patients that inflammatory hyperplasia, you treat the denture with antifungal medication. The redness disappears,
Okay.
but you still see that looks like a raspberry patch. All right. And you can also, in rare cases, you can get inflammatory hyperplasia in patients that don't wear a denture. That's rare, but usually it's somebody that keeps a denture in all the time.
All the time.
And it doesn't have any malignant potential. Like a fibroma doesn't have any malignant potential.
Yeah.
When you guys take your final, I noticed the quizzes, a lot of them are identifying lesions, which is I like, but I don't see many multiple choice questions. Did she ask multiple choice questions much?
on the exam.
Yeah.
On the exam?
Yeah.
Yeah.
Okay. But why is she not
Half of
giving
them
you
is
more for the
writing,
quiz?
half of them is,
Well, half of them's writing?
half of them is writing, yeah.
Okay.
Half of them you have to write
Okay.
what it is,
Right.
what it is, or
Okay.
characteristic, all that question you have to write
Okay.
with the computer.
But you do have multiple choice.
Yeah, we have multiple choice.
Yeah, it's nice to be able to, I think that's good to be able to identify, to look at things, you know, to come up with a name.
Yeah.
We have to know the cysts too, right?
Yeah.
So thyroglossal duct cyst.
No, we're not on, we're on cysts a little bit too today.
Yes, I
Yeah.
think so.
Branchial.
Thyroglossal duct cyst, that is a rare thing, but what happens, you remember when the thyroid gland starts, where's it start? Base of the tongue. And then
Okay.
it has an epithelial tract, and
Mhm.
it migrates down and ends up with the thyroid. So
Mhm.
sometimes you can have that tract that's left over, lined by epithelium. Anytime you have epithelium left over, epithelium can produce a cyst. So that's the thyroglossal
Mm.
duct cyst. Well,
Okay.
years ago, my wife and I were visiting a good dentist friend of mine. I mean, this is back after my first 5 years of practice. So we were just visiting, and they had a little son, 2 years old. So he was playing in the front room while we were visiting. My wife said, "Hey, come here a minute." So she grabbed his neck, and she said, "Well, what's that?" Well, nobody had noticed before, and I don't know how she noticed. She noticed a bump here. Well, it ended up to be a thyroglossal duct cyst. Yeah. You know, so that kind of helps you remember that. So that's where it's from.
Yeah.
Now, a cervical lymph epithelial cyst, okay, and what name do you use? Cervical lymph epithelial?
Yeah. That's
Okay.
in our notes.
Okay, so what is the cause of that?
Cervical.
So what's the name say?
Cervical.
Yeah,
So-
cervical means where? Here,
Yeah.
Yeah.
okay, it's on the side,
Yeah.
okay?
And then lymph nodes.
Has something to do with the lymph nodes,
Okay. Cervical lymph.
lymph
And the
node,
epithelial too.
epithelial, right.
Yeah.
So epithelium gets entrapped in lymph nodes.
Uh-huh.
Anytime you get epithelium, you always have the possibility of a cyst, okay?
Okay.
So that, and I've had patients, I remember having patients with a big nodule growing for a long time, a big area like this, and that was a cervical lymphoepithelial cyst. And they can get pretty big, filled with fluid.
Mhm.
Most people are not gonna live it, so that's what they're from.
And is the definition of a cyst just having its own?
A definition of cyst is lined by epithelium
Uh-huh.
with a lumen in the center. That's
Okay.
the cyst.
Okay.
Yeah. The true cyst is usually lined by epithelium.
And then regular, like, for example, a pimple wouldn't be lined with epithelium?
No.
Okay.
All right. Let me get the test. Sounds like you guys know it pretty well. So did you take your girlfriend out? Did you have time this weekend?
No.
No!
That was your birthday.
You don't want to ignore her.
Oh yeah, it was, huh?
It was his birthday.
His birthday?
Oh yeah,
Yes,
yeah.
his birthday.
Well, did
Oh,
she
yeah,
take
thanks,
you
yeah.
out?
No, I didn't have time for that.
You always have time you always gotta have time for that.
Yeah.
You know? I gotta talk to you guys.
That's
You
true.
know, it's
Yeah.
not all
We're out of
school.
life. My
Huh?
boyfriend left me. He went back home.
You went back home?
Yes.
Well, you
he
got
said
more
when
time
you're,
to study.
Yes, he said when you're done, I will come back.
Get back.
Because I'm out of school every day, all day. So he came back home. No, he went back home.
Oh, okay. How much is a flight to go to?
24 hours.
Oh, it's 24 hours.
Yeah, you change 2 planes and then you stay in airplane 24 hours.
Oh wow.
So, where do you fly to? England or somewhere?
No, you can go there, but if you go to Europe, you have to change one more airplane. So it doesn't worth it. But one of my friends does all the time like this. She goes to German, and then German change the airplane. Go to Turkish, and then change the airplane. Go to my country.
What's Turkey like? Is that nice? You've been there?
Pretty. Yes.
Pretty
I
nice
like
country?
It. Yeah. Istanbul is pretty.
Really?
Oh,
Istanbul
I
is
heard about
pretty?
It's busy, but it's pretty.
Oh.
Nice buildings. I like it.
Oh.
Good food.
Oh wow.
Nice.
We usually go to Turkish or Dubai, and then change the airplane, and then go to
How's
Iran.
Dubai?
Dubai is good.
Is it
but it's so hot. You
It's hot.
sweat.
Yeah.
Yeah, I've been there. In Abu Dhabi and then Dubai.
Yeah.
Yeah, nice malls. If
Yeah.
you want to buy this stuff,
Yeah, I had a patient who was,
but it's clean.
Clean.
Clean, very clean.
I was a patient who was in the United States, a dental patient when I was here, and he was kind of like taking studies at Cal State. Then he became an ambassador from Dubai to some country, United Arab Immigrants or however it's said. He always said, "Come on, I'll take you over there." I never did. But they must have a lot of money because he flew here. He was living there, and he flew over here for a dental appointment to see me.
What?
Yes.
Wow.
Yeah.
Wow.
I said, "Why are you
He
here?"
really
"Oh, I came from a
liked
dental
you.
appointment."
You're a good dentist.
Yeah. I kind of got friends with him a little bit. You know, my son was in a play in Berlin, so I took him to the play one night and things like that. Heck yeah. Yeah, it was really a nice guy.
Thank you.
Wow. That's a lot.
All right. We are quiz 6. Today's Halloween day.
Halloween. Oh, happy
Oh yeah.
Halloween.
Happy Halloween.
Do you celebrate it? No.
No, it's a pagan holiday. We shouldn't celebrate it.
Pagan holiday.
It is.
Oh.
Yeah. When you really look at the history of it, you look at the history of Halloween, it's like, I don't want my kids or grandkids to celebrate. I
We
mean,
don't have Halloween.
yeah. I mean,
Oh,
look,
yeah.
you shouldn't.
We don't.
You really shouldn't. No. It's not a good, I mean, people really don't look at what it was based on. You know, it's the devilish type of thing.
Yeah.
Okay, are you ready?
Yeah.
All right. Boy, look at, man, what a big screen. We're in. Okay, here we go. Oh, wait, I have to take the quiz too. It's great. It's not very, there's only about 6 questions.
Okay.
Thank you.
Okay, here we go. Well, that's how we kill someone.
Oh my gosh. That's like sound. I think put this arrow.
Oh, if you go that way, it does?
Yeah.
Yeah, it's number 1.
Yeah.
Okay, you ready? That was an easy one.
It has a voice on it? Awesome.
Kind of looks like it's snake fur or something.
Pardon?
It looks like a snake fur
Yeah.
looking thing.
Looks
I
like
don't
a
know.
raspberry patch. All right, you ready?
Yeah.
Okay, I just switched to another one. I think we have one more and that's it.
Which is five.
Pardon?
5 questions.
There's 6, I think.
Okay.
This is number 5. And here's number 6. And that was the end.
Will you accept 2 answers for one of the questions?
Would I? Sometimes I could.
Okay,
I mean, maybe.
maybe.
What question are you talking about?
Number 4.
Oh,
Is it okay if I see number
Ye-
1 more time?
do what?
Number 1, please. Thank you. But the color is pink, yeah? It's not purple. No, it's pink.
Oh, it's pink, and then on the buccal side it's more reddish. All right, let's go. Don't write it. You guys through?
Yeah.
All right, so let's go through. So, what do you have an answer for this one?
Pyogenic granuloma.
I chose peripheral ossifying fibroma.
Pyogenic granuloma.
So,
It's
okay.
ossifying. It's all here. The pyogenic one is out here and it's purplish, but this guy is not purple.
No, not necessarily. See, remember I told you you always can't go by how it looks. But there's something in the history here. What's in the history that led you to pyogenic granuloma?
Female.
Like
Okay, what else?
Bleeds.
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 Sheep.
That's a key. that's the key. So that's why the answer is pyogenic granule.
Pyogenic.
But it's not
Ossifying doesn't bleed. No.
a what?
The ossifying doesn't bleed. No.
Not as much.
God.
Right. But I may give you credit. I always say it could be any one of the three, so I'll probably give you credit. But I like pyogenic granuloma better. Do you see why? Although I agree with you, it's not as red as some of them are.
Mm-hmm.
All right. So I always say it could be one. You can't always tell. It could be any one of the three. So, but because she said it bleeds when brushes her teeth, the pyogenic granuloma, that would lead me to the pyogenic.
Pyogenic.
Yeah.
Okay.
But not that your answer is wrong, but I like their answer better.
Mhm.
Okay. This one, what?
F?
I got inflammatory papillary.
Papillary.
Yes, number F, right?
Yeah.
Yes.
Okay. This one,
Brachial.
Brachial.
It's brachial.
Or a cervical lymphoepithelial cyst. That's a
Oh,
the
yeah,
other
that's another
other
name
term.
for
Yeah.
Cleft cyst. Yeah. Brachial cleft cyst. No.
That's brachial.
what do you see in the X-ray?
Radial lucent.
There's that little
Sac.
radiopaque area.
Yeah, what is that?
That's a cyst.
A what?
Is it tumor? Cyst.
A cyst usually not going to show up in X-ray.
Uh,
This is dense like bone.
Wow.
Would it be?
I didn't put an answer.
Genius. Does it have answer? Does it?
Well, based on the X-ray, it.
So it's not a cyst because you say cysts don't appear on X-rays.
But if you have a cyst end of the tooth on X-ray,
But she's,
it's moving.
but what did she say here? An adult female complains of pain and swelling that is worse at mealtime. What happens at mealtime?
Oh, you
Salivation.
swallow. Right? You swallow food.
But the
Okay,
others.
but what
is
happens?
swallowed.
What makes you? When you get when ice chocolate cake is set in front of you, what happens to your mouth? It gets dry or it gets watery?
Water.
Watery.
Okay, because what?
Salivary
Salivary.
glands.
Yeah, your salivary glands
Or
are
that
working.
salivary gland something?
Yeah, some of their salivary gland.
Oh.
What does?
Can you find the answer?
Yeah, I would say.
Dermoid? No, it's not a cyst.
No.
No.
Epulis? No. No, that does not.
I can't find an answer.
There is nothing there.
I mean, the closest thing would be like that would cause a radio opacity would be like a fibro thing with bone, right?
This is fibroma's not for you.
Okay.
Yeah, to me, you guys haven't even had this yet.
So it's a mistake.
I
No,
think
it's
it
not a
is.
mistake. She doesn't do a mistake.
Pardon me.
She doesn't do it. We do.
No.
You have this in cyst. I don't know.
Cyst?
When we do cyst tomorrow, you'll see the answer to this.
Oh. What is the answer?
This is a stone. This is a salivary
Stone.
stone in the in the duct. In this
In the gland.
in the duct.
On the duct.
Yeah.
So that's a free point.
And what?
A free point.
She doesn't have free for you know that.
Oh, Okay, but
So
I'll
it's
show you.
like
I'm
for
not. I'm just gonna leave
tomorrow.
it blank. Okay, what's this one? And you'll see tomorrow. And I agree with you. What you're saying, Heidi, is you're saying you could put two answers. You would put V,
Yeah.
or you would put juvenile
Yeah.
hemangioma.
Yeah.
H. You would put either one of those.
Yeah, but I put V.
I put V for
V,
Yeah.
yes.
yes.
Yeah,
Malformation.
same.
That's malformation.
But this guy doesn't look like a juvenile, does he?
No.
Not really.
Okay, what's this?
That is irritation, fibroma.
Yeah, no, quite
Fibroma.
irritation fibroma.
When they touch it, so it's a
Firm,
spongy,
hard. No,
hard,
hard.
hard. Okay.
I mean, not stony hard, but firm.
irritation, fibroma, it's hard.
Okay, and this one?
Granular cell tumor.
Granular cell
Can I
Good.
can I make sure? What was the answer for 4?
Four?
V, right?
It's
Yeah.
V
Oh, yeah.
or
Malformation.
I
Venous
know
malformation.
Heidi was thinking of H.
Yeah.
Did you
Okay.
put H down too?
Nah, I crossed it out. Yeah.
Yeah.
Is is a hemangioma considered a venous malformation as well?
Yes,
It
it
is.
is.
Okay, same
Actually,
thing.
they used to call them hemangiomas. Now they're trying to change the name. They call it a venous malformation. So they're trying to change the name on it.
Oh, okay.
But it is a hemangioma.
Okay.
So so you guys for 4, you put, I mean for 3, you put branchial cleft cyst. Yeah, without that X-ray.
Yeah.
Yeah.
But that's here. Branchial cleft cyst is usually more back here.
Oh.
So a dermoid cyst is usually in the middle.
Yeah. That's what. we
So
were thinking.
and for 3, you put branchial cleft. Now let's see. Sarah, you guys all put branchial cleft. But branchial cleft, okay. With the X-ray,
We'll go with the salivary.
you'll see when I talk to salivary gland.
Yeah.
All right, get your notes out. Now, one thing, she gave me some, I'm gonna go through my notes first, because she gave me some notes. Actually, Dr. Grande did the notes, but Susan did the slides. And I find out they don't correspond as well as it should. Where's the notes, Josh? I don't want Josh. I want that. Here we go. All right. Okay, so let's go, so you have her notes, right?
Yeah.
Yes.
Yeah, and those pretty good notes. Okay, so I'm gonna show you my notes,
Okay.
because they follow it a little better. Hers, she's got, she did it like what's on the lips, what's on the floor of the mouth, what's on the tongue, which is a good way to do it too. But I just wanna go through each lesion. And then we'll look at hers too. So and that'd be a good way to review. Okay, so in soft tissue lesions, a lot of them are reactive and a lot of them neoplastic. Reactive is reacting to some type of stimuli. So if it doesn't have a stimuli like a fibroma, it could quit growing. Where a true neoplasm grows on its own. Like a squamous papilloma is a true neoplasm. But an irritation fibroma is a reactive lesion. Pyogenic granuloma is a reactive lesion. Okay? So a lot of these were reactive lesions. Okay? So a reactive lesion responds to irritation, and you have a recognizable stimulus like calculus. On a pyogenic granuloma, the stimulus can be calculus because often that's what causes it. Okay, so here's what a fibroma looks like. Slow growing, all right? They can be pink or white. Why would sometimes they be white?
Epithelium.
Epithelium.
Well, they're covered by epithelium, but what's the epithelium have? What are you doing, writing on your computer?
Oh yeah.
You have it, you can write on it?
Yeah, it has
Hey,
a.
you guys are just a lot far ahead of me.
Yeah, he is.
Oh.
Writing on the computer.
Yeah, I guess. Yeah.
How does that work?
It's
Like a
just
pen.
yeah, it has
Oh,
a sensor.
Is this an iPad too?
Oh no, this is just a
never mind.
HP.
Okay.
Yeah, it has that capability.
So, but when you write on it, it doesn't stay on the computer, right?
Yeah, it's
What?
yeah, it stays on the. Oh, not on the screen, but
It doesn't go on to.
not on the screen. Yeah, but in
On
the
the
document.
Oh, it does stay.
Yeah. hmm Yeah.
Wait, does yours not flip all the way?
Oh, it does flip
Yeah,
all the
you
way.
could
Yeah.
Yeah.
try.
Oh yeah, you could flip it
Like
the whole way.
magic.
Like an iPad.
Yeah,
Tada.
like this.
We can't do this with ours.
Oh yeah,
I
it's,
can't do it. Can you do it?
No.
He's
Yeah, I could.
the
Yeah.
first.
Let's see your screen.
Yep. So I could write. Yeah, I wrote slow growing.
And it's really small.
Yeah, I could change the size. Yeah.
That's pretty clever. Too advanced for me.
Yeah.
Okay, so they're very slow growing. I mean, one like this be there a couple of years, and there's not there's not a high possibility that would be malignant, right? They don't turn out. If it, what would be the malignant counterpart of if it was a tumor, a fibrous tumor? What would it be called? And this would be for part of your path thing. If it's fibrous tissue, what is the malignant counterpart of a fibrous tissue? What is a malignant fibrous tissue called?
Sarcoma.
Okay, it's a sarcoma. What type of sarcoma? What kind of tissue is it? Did I say?
Bone.
Epithelium.
Oh.
No,
No?
fibrous tissue.
Yeah,
Oh,
fibrous.
yeah.
Fibrous.
So what would it be called? Just put those two names together.
Irritation? No.
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 Fibro.
Fibrosarcoma.
Yes,
Oh.
fibrosarcoma. Okay.
Yes.
Why isn't that called a fibrocarcinoma?
It has to do with the type of tissue.
Because it's not epithelium; it's fibrous tissue. Carcinoma is from
Epithelium.
epithelium
Okay.
or from ectoderm, right?
Yes.
This is from mesoderm. Okay.
This guy is symmetry or asymmetry?
Pardon?
Symmetry. This guy, the irritation fibroma is symmetry or
Yeah,
no,
it's pretty elevated.
elevated?
Often
Okay.
they're sessile based, like a squamous papilloma is often pedunculated, a small base. These often have a broad base, so it's called sessile. Okay, so most common lesion in the oral cavity. Okay, etiology here is reactive fibrous tissue in response to local irritation or trauma, not a true neoplasm. Remember we said that? Reactive lesion. Sessile or pedunculated nodule, usually sessile. Sessile means broad base. Okay, could be pedunculated. Adults, mostly 4th, 6th decade, male to female, most common in female. I don't know why. I mean, that's surprising. I would say it's even. I didn't know the answer to that. I would say it's probably even both. Color, pink, white due to hyperkeratosis. Remember I told you why they're white? Okay. Surface smooth. That's how you differentiate it from papilloma. Site, most common location, buccal mucosa. Why? Because you would bite them. Or side of the tongue, right? Did she put tongue? Okay. Also tongue. You could have had them on that gingiva. You usually don't see them on the gingiva. Frenal tag. Okay. Frenal tag is, you'll see these in patients where you have the frenulum right there.
Yeah.
Okay? And a lot of times you got a little tissue tag there. And they're fibrous tissue. They're actually hereditary. People think people bite it, but frenal tag, that's what a frenal tag is. Yeah, actually I read that they're not really from trauma. A lot of people thought it was where the frenulum got caught between the front teeth. We freed the path, folks. It's somewhat hereditary. Okay, so histopath, these are just connective tissue, all right? With squamous, thin squamous epithelium over the top of them, right? No capsule. May show chronic inflammation, not usually. Treatment would just be cut them off, and you're not going to get a recurrence, okay? And no treatment for renal tag. So let's look at some more. So here's a couple more. Classic, all right? The one on the right here looks like somebody bites it all the time, right? Common, slow growing, asymptomatic. They usually don't get much larger than about a centimeter. That's the largest they get. Pink or white. Common areas, mucosa, tongue, rarely recurs. When they're excised, they don't have a high recurrence rate. Okay?
Is slow growing like 1 to 2 months, or even
1 to 2 to 3 years.
Oh,
Okay, 1 to 2 months would be fast growing.
okay.
Yeah. Slow growing, a few years. A lot of times patients will say, "Yeah, I've had that for many months or a couple of years." Okay, epilus fissuratum. Is that next on your list?
Yes.
Well, okay, at least my notes so far. I hope my notes somewhat follow this. Okay. And you can see where the denture sits in on that stuff.
Yeah.
Look, the denture sits right here, flange of the denture, and the denture sits right in here. And this is all fibrous tissue. This is nothing but a fibroma. That's, it's the same thing. All right? These can look mean sometimes. Look at here. So I often ask in class, and I get a laugh, and I don't understand why. I say, "Will the real rich please stand up?" And they laugh. But it has something to do with a song, right?
Yeah.
What is the song?
It's Eminem.
The rapper.
He's like, what's the original? It's like,
The real Slim Shady.
yeah.
Because, I say, "Well, will the real rich please stand up?" Now they all laugh. I don't know idea what you're talking about.
Yeah.
That's a commercial things for Eminem.
No.
No.
It's
You're
a
the
rapper.
rapper?
Oh, rapper.
The
I know
rapper,
Eminem.
yeah.
Got it.
So here's where here you often get ulcerations in this area right here. See that? So here's the real ridge right here. See that? This is the epilus fissuratum, and this is. Now look at this one here. Here's the real ridge right here. Okay? And then all this is the epilus fissuratum. This one could look malignant.
Yeah.
I mean, I don't think so, but could have that. Okay, and then you can have epilus fissuratum that's back on the back part of the palate. This is called a leaf-like, and she doesn't even talk about this one here. So, epilus is a genetic term meaning on the gingiva. Okay. So you can see where here's where the flange of the denture was. Can you imagine having this thing in the palate? Just flips down. Yeah. And people ask, well, why people don't have these removed? When I'm teaching a class. My answer is they're attached to it.
And it doesn't hurt, so it
Doesn't
doesn't bother
hurt.
them.
And they get attached. When I say attached, two ways, right? Psychologically they're attached, and then physically they're attached to it.
Oh.
Okay, here. It's a epilus fissuratum, type of fibrous hyperplasia in the vestibule. That's where these are. Okay? Related to a loose denture, could be ulcerated, multiple folds, rare malignant transformation, and then those fibroepithelial polyp. That was this. This is a fibroepithelial polyp. Okay? So those could. So have you seen these? You've probably seen these pictures before. All right, quiz.
Not that one.
Not that one.
Yeah.
Okay, papillary hyperplasia. I guess we don't need to go through that. Everything we talked about is there. Okay. Yeah. Okay. Here's a couple. Now look at the one on the left-hand side. The patient's got teeth, so why would they have papillary hyperplasia?
They have a retainer, maybe?
Yeah, they have retainer.
Yeah,
Where?
so-
You can see it goes up right here.
Yes.
So they're missing the anterior tooth. And so here's the redness here. So a lot of this redness is due to candida, all right? So here's where we don't have candida, right? And this, and the treatment for sometimes they'll say reline the denture with a soft liner or something like that.
Yeah.
But that won't make this go away. It will help it some go down, but surgically the only way you can do it is remove it.
Just removing it?
Yeah,
Okay.
yeah. Well, it's not an easy thing to do. So let's look at our notes on inflammatory hyperplasia. Reactive tissue growth that develops beneath the denture. We know that. Unknown pathogenesis may be related to ill-fitting denture. Yeah, we talked about that.
Yeah.
We talked about poor dental hygiene. Wears the denture 24 hours a day, right?
Yeah.
Okay. Here's the word candida. All right.
Candida.
Organism also just as a cause can play in a certain role. Least it makes the redness. Okay. Clinical features: multiple erythematous projections, pebbly or papillary. Do you know what pebbly means, Sarah?
Something like,
A pebble.
yes.
Pebble is a rock. So the old roads were made of rocks, so that's
Yeah.
pebbly surface. Okay. Site: hard palate beneath the denture base. Okay. Histopathic features: papillary growth covers a hyperplastic treaderous squamous epithelium, and it has connective tissue. A lot of chronic inflammatory. That's why it's red. Treatment: very early to use and remove denture, and sometimes edema subsides. But advanced ones, you have to excise, as it says in your note. Excise the hyperplastic tissue before fabricating new denture. May show improvement after topical or systemic antifungal therapy. We talked about that. You treat them with antifungal and the redness will go away. Align the existing denture with a temporary tissue liner. Okay, you do that. After healing, you have a new denture. Okay, here is some under a partial. Could be an allergic reaction. A lot of partials they put in nickel. If they were made overseas. Okay, papillary hyperplasia. The palate, denture is 24 hours a day, pelvic surface, asymptomatic. Candida, all these relate to it, right?
Mm-hmm.
Also seen in flippers. And once in a while it can happen in people that don't wear dentures. That's rare. Okay? So you don't even have to study for the test in this degree. This is so easy.
they all mix together. It's not easy. All together.
Do what now?
But for the final, it's all together. So it's not easy.
Yes, it's easy for me.
Yes, for you.
Hey, I haven't done this for. I even have a hard time coming up with some names right now. Believe it or not, because I haven't dealt with it for 5 years.
Mm-hmm.
Well, I lecture once in a while, but not like every day. So. Okay, 3 P's. Well, what's she has
Yeah.
next on her note?
Pyogenic granuloma.
Okay, so they followed my lecture. Okay, so I always think of the 3 P's: pyogenic granule, peripheral giant cell, and peripheral ossifying fibroma. Okay, so pyogenic granule. Let's look at that one. Common tumor of the oral cavity, right? It is. Etiology represents exuberant tissue response to local irritation or trauma. Precipitating factors: poor hygiene. Not always. Pregnant women may have good hygiene. Not a true neoplasm. Reactive lesions. We talked about that. You need to sleep more at night, Heidi.
What?
You need to go to bed earlier. You're yawning.
I know.
You can yawn.
I know. I'm like,
I can see your
I'm
tonsils
like,
in that yawn.
Do you have it? Do you have your tonsils?
yeah. Maybe I just need to eat something.
Or you need to eat something.
Yeah.
That keeps you from yawning?
Yeah.
Make you awake.
You guys, I don't know how you guys put up with me. Okay, but no, you're learning this. Okay, clinical presentation: sessile or pedunculated. We know the difference between those two. It can be either one. Age: most common children, young adults. Usually you don't see it in older adults. Okay.
Look, I have a question.
Yes.
So this is out, but in a question, in a quiz, no, number one,
Yes.
first question, that was the other side too.
Well, it can be buccal or lingual.
Really?
Yeah. Yeah. Because comes, yeah, if you got calculus on lingual, it could go both
Could
sides.
be, oh, okay.
Yeah, could be both. But usually you see it on the buccal. Okay.
Okay.
The picture on the left is very classic. You can see how red this is. That would have been a better picture to show you. This one here.
Yes.
Yes.
That one would
Right.
have been way better.
That's it that I thought.
So gender, female, possibly because of vascular effects of female hormones. That's true. Color, pink, red, purple. Can be purple once in a while if it's very vascular. You don't see it that often. Surface can be ulcerated, smooth, or lobulated. Either one of these things. Site, 85% usually on the gingival tissue. And here, facial anterior maxilla gingiva common. Like you were saying, Sarah, usually you see it on the facial. Okay. Also affects lips, tongue, and buccal mucosa. So, remember, it can be other areas where for the other two are only on the gingiva. This one can. I have a picture of one on the tongue. Can be on the skin too,
Yeah.
but rare. But when we think of them, we always think of them on the gingival tissue. Duration, rapid growth. When I say rapid, I'll show you one that can grow in a couple months. Okay. Painless. They're usually painless, but they bleed easy when you brush your teeth. And what did she have on the quiz? After brushing teeth, it bled. Okay? May begin to develop during the first trimester of pregnancy. Increased prevalence up to the 7th month. Okay? After pregnancy may return, if the hormones return to normal, it may get a little smaller. Okay? Epidermis granulomatosa. Oh, she puts that in here. I have that too. What that is often sometimes. Have you had epidermis granulomatosa? She puts it in the notes, and I'll show it to you. We'll come back to it.
Here.
Okay.
Epidermis.
Epidermis? Oh yeah. It's
Yeah,
right
in
here.
middle. Yes.
Yeah.
She
But I
said we
don't-
should know this.
Okay. What it is that sometimes with a tooth extracted, maybe a little piece of calculus falls into that socket, all right? And that calculus causes an irritation. So sometimes when you get irritation, tissue proliferates to irritation. So you get a pyogenic granuloma that grows right out of the socket. And I'll show you pictures of that, okay? It says here, seen in healing extraction sockets represent granulation tissue reacts to bony sequestration in the socket. Or a little piece of bone that left there, a rough piece of bone can do it. Histopathology of this, highly vascular, because it's granulation tissue. Granulation tissue is a lot of vascular spaces, okay? Endothelium proliferation, which is vessels, and a lot of inflammatory cells, okay? Treatment, conservative surgical excision is usually curative. So you go in and usually get rid of this, and usually it goes away, all right? You scale the teeth, get rid of whatever the rough area. Excision should extend down to the periosteum. Scale adjacent teeth to remove any source of irritation. See? Recurrence rate 3 to, not a high recurrence rate. Pregnancy tumor, often you may not want to remove it until after they deliver. So I'll show you why. Here's a couple more. This one, here's one, not as red. Look at this one here. That looks nasty, doesn't it? Huh?
Yeah.
Mm-hmm.
Here is one. Look how big this one is. So when I saw this one, she was 7 months pregnant. Finally came in because she was biting. See where the lower teeth were heading it?
Mm-hmm.
So that we removed it up in oral surgery. In 1 month, it was back to this size again. So that, I mean, they had to remove it before she delivered because it was irritating. But then after, they didn't remove this one until after she ended up delivering.
Okay.
And then they removed it. But see how fast, I just want to show you how fast that
Yeah. That was
came back.
cute.
And here's one on the tongue. I mean, there's no way I know what this is, but only from histology. You said. Now here's the histology. You got epithelium, okay? And then look at all the vascular spaces here, okay? So it's made up of these, that's why they're red, made up the vascular space. So, let's review. common, red, maybe ulcerated, bleeds, fast growing, is made up of granulation tissue. Most common sites at gingiva by far. I mean, the most everyone you're going to see is the gingiva. Made up of granulation tissue. We're repeating that again, but granulation tissue is vascular tissue, fibrous tissue, inflammatory cells. Okay. Pregnant women. Okay. Well, you shouldn't get pregnant again if you don't want to have a pyogenic granuloma. And they may recur, but not high. Okay. Okay. Peripheral giant cell tumor. Let's turn the page. How are we doing on time? Oh, we're doing all right. Now, peripheral giant cell granuloma, now we call it a tumor, but she called it a granuloma. Okay, relative common tumor, like growth, but not as common as a pyogenic granuloma. So, it is, again, a reactive lesion to local irritation or trauma, not a true neoplasm. So, just like the pyogenic granuloma, it's a reactive lesion. Clinical presentation, sessile or pedunculated, just like pyogenic granuloma. Any age, females, a little more than males. I mean, color red or red-blue. So they're not quite as vascular looking. Sometimes they can be more pinkish. May or may not be ulcerated. So the one on the right-hand side is more pink. But these can be more aggressive. Remember I said they can be more, this is separating the teeth, all right? This one here is growing on the lingual. You know, I probably would, if you showed me that picture, I would say peripheral giant cell tumor, because it's not as red as a pyogenic granuloma. So I never really in class ask you to name what it is. I want you to come up with a differential fibroma of the three possibilities. And I want you to list what you think it is in order. But I'd never judge you off for what order you put it in, but I want you to think what order it's in. Does that make sense?
Yeah.
No. Because there's no way to prove it. And where to get giant cells? Okay, here's one that was removed, and here's the tumor right here. And if you look in there, it has the giant cell, plus a lot of fibrous tissue. So that's where the name comes from. And here's a couple more. Here's another one. Here's a young one on a young kid. And I could actually put a perioprobe under this right here and flip that all the way down.
Yeah.
Yeah. And it looked nasty. Okay, what was the irritation? The stainless steel crown. That's what caused it. A rough margin on the stainless steel crown. Yeah.
Yeah.
So, review. So, only occurs on the gingiva because it comes from the periodontal membrane. Okay? Up to 2 to 3 centimeters, so these can get pretty good size. You know, look at all these, look how large that one is, see? Aggressive, because it can move the teeth around a little bit. Etiology, probably trauma. Again, painless, average age 30. So you got a little higher recurrence rate on these, because they're hard to remove. I mean, that's not, you know, sometimes you have to remove the teeth because it comes from the periodontal ligament. Okay, now peripheral ossifying fiber. Any questions on that? See, you don't have to study for next week. We're learning everything today. Yeah.
I have a question. Is tumor not the same thing as a neoplasm? They're two different.
It is a neoplasm.
It is.
Yes. Yeah.
Okay.
A neoplasm. Tumor is a broad term. Neoplasm. Sometimes you can use them interchangeable. Yeah. Okay. Peripheral ossifying fibroma. Here is one difference of peripheral ossifying fibroma. What is the name on here? Fibroma. So it's a fibroma that occurs on the gingival tissue. So why don't we just call it irritation fibroma? Here is the difference. Because see that middle name, ossifying? Sometimes these things can have calcification or bone within them. So that's why. So peripheral means it's on the gingival tissue. So would you expect these to be more pinkish, like a fibroma? And not as red as a pyogenic granuloma?
No. Or
I'm guessing more pinkish?
Yeah,
More
it's more
pinkish,
pinky.
no reddish.
Yes, not so much reddish.
So that means
Because
no
they're like a
blood.
fibroma.
If they brush, no blood.
Probably not as much.
Okay.
Right.
Ossifying,
Because
no
they're
blood.
fibrous tissue. Just does a fibroma bleed when you brush it? No. So these don't bleed. So the one on the left-hand side up here is classic. I mean, if you ask me the three things about this in a differential diagnosis, first one I'm going to say is a peripheral fibroma, because that's what it looks like. Pyogenic granuloma would be last on my list of the three P's. Does that make sense?
Yeah.
Mhm.
I mean, even if I told you to put them in order,
Mm-hmm.
and you put pyogenic granuloma first, I may mark you wrong.
Yes.
Depends how I feel that day. If I like you, I won't mark you wrong. If I don't like you, I'll probably mark you. But I like all you guys.
Oh.
Even all the terrible things I hear from your classmates about you guys.
No.
No, I don't care.
No. They're so good.
And look, here's the, you guys are lucky. You guys get to study more oral path, learn better than they do, more than they do.
Yeah, we're ready for boards
Huh?
after this. We're ready for
Yeah,
boards after
yeah.
this. Like,
Yeah, you will.
hopefully.
You will.
Yeah.
Okay. Okay, here's a couple more. Look how big this one is. This was on a young kid that I saw. He finally came in because he was finally biting on this. Thing was ulcerated right here. So I would think a peripheral giant cell on this one too.
Yeah, that's what
Yeah,
I was gonna
right?
say.
Yeah, yeah. In fact, peripheral giant cell would be first on my differential diagnosis because of the size of it and everything. Yeah. So now, what would be first on your list on this one?
Pyogenic.
Yeah,
Pyogenic.
pyogenic. So how can I mark you wrong if you see what I'm saying?
Mm-hmm.
You can't tell the difference.
Yes.
But now, whoops, what happened? But here I want to show you something. The word ossifying. So here was one distal to a second molar. Well, no, this is would be a second bicut medial to a. Actually, it's, of all the years I've taught this, I've probably said the wrong thing. The first molar or bicuspid was here. This first molar on the mesial. So look at the calcification. Here's a picture. Somebody took an X-ray of one that was in the mouth, and this showed the calcification. So a lot of times you could tell once you remove these, if you cut the scalpel through it, you heard crunch, 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 crunch going through the calcification. Okay. So that's why that word ossification. Not all of them have that,
Yeah.
but some do.
Okay.
All right. Okay, let's go through the notes. Relatively common. I have a hard time with common. They're not common, but compared to other cancer, it is more common. Reactive rather than neoplastic, so all three of these reactive. Pathogenesis uncertain, probably come from the perineal ligament, if you read the book. Origin for mineralization product may be cells of the periosteum. See, that's where the perineal ligament. Okay. Clinical presentation, pedunculate or sessile. Teenagers or young adults, just like the other ones. Cases, females, all three of these more common in females, but she's not going to ask you that. Red or pink, okay, most of them are pink, but here's one that looks on the red side. Occurs exclusively on the gingiva, right? 50% are in the incisor cuspid region. Duration may be present for weeks or months. Rarely migration and loosening of the adjacent teeth. It can. What is the histopathology? It's fibrous proliferation. And you can have mineral products like bone or cementum or calcification. And it could have multinucleated giant cells also. Excision, just a local excision. And you get a recurrence rate 18 to 16%. So let's look at my note. Smooth, normal color, all right? Only gingiva, that was in the notes. Irritation can cause them. Young adults and children, we talked about that. Dense connective tissue may reoccur. X-ray, you may see radiopaque foci. Right? So now you're experts on the 3Ps, right? Okay, Here's my favorite question. Tell me what this is in the differential diagnosis.
So
Pyogenic.
Pyogenic?
Yeah.
What next?
I would say
Peripheral.
Ossifying. Peripheral ossifying. What is
granuloma.
granuloma?
Peripheral
Ossifying fibroma.
ossifying roma or peripheral giant cell?
Yeah.
I would say
Giant cell.
Giant cell.
Not ossifying.
And on peripheral
Because it's
fibroma.
red.
Yeah.
On a biopsy, you can't always tell. This was a peripheral fibroma. Peripheral fibroma would be the last of my differential diagnosis.
Yeah.
So what I'm trying to emphasize, you can't always tell.
Tell.
Right? But at least think of those three and you're on the right track.
3 pieces.
What's the most common of those three?
Pyogenic.
Pyogenic. Okay, here's the epilus fissuratum. Okay, so you had an extraction of a tooth. Okay? And then some calculus in there or bone. So what happens? You get granulation tissue reacting to this irritation, and so you get granulation tissue growing right out of the socket. And you just go in there and curate that out, and that takes care of it. So site of an extraction, so it's always from an extraction site. This granulation tissue may look like a metastatic lesion. Boy, it could look like a metastatic lesion growing right out of that. Bleeds easy, because it's like a pyogenic, actually it's a pyogenic granuloma, is what it is, all right? Cause some type of irritation. All right, what's our next one?
Lipoma.
Okay. Lipomas, most common mesenchymal neoplasm, not in the mouth, but they're rare in the mouth. So, but in the body. Now, what is the difference from just plain fatty tissue than a lipoma? What happens if you lose weight?
It'll stay.
It will stay.
Yeah.
Fatty tissue will go away. Okay? So this is a true neoplasm. It's a neoplasm of lipoid tissue. So it's a benign tumor of fat. Okay? Uncertain. We don't know what causes them. Most common in obese people. I didn't know that. I mean, however, metabolism of lipomas is independent of normal body fat. Okay, so that's what we just talked about. Clinical appearance, sessile or pedunculated. Adult, usually 40 years of age, yellow-pink, okay? Smooth surface, able to see delicate pattern of blood vessels on the surface. That's if you see it in the mouth. Consistency, soft. You press on it, feels like fatty tissue. Okay? Common site, buccal mucosa, buccal vestibule, okay? Anywhere. They can occur on the tongue, anywhere. But they're not common, rare. You don't see them that often in the mouth. I mean, for the most common lesion, they're rare in the oral cavity, all right? May be present for many months or years. Totally asymptomatic, no pain.
No pain.
Composed of mature fat cells, all right? Treatment, conservative excision, and rarely do they occur. So here's one on a patient in the clinic. Look, she had the thing on the neck. You know, why would you want that there? That's the back of the neck. So she let me take a picture of it. I mean, why? I mean, I don't know it's a lipoma, but it's soft. I thought it was probably a lipoma. Been there for years.
And she didn't want to take it out?
They're attached to it.
They can't just put the needle on it and then suck the fat out?
No,
Why?
because they are encapsulated.
Encapsulated, okay.
Encapsulated. Yeah, you would want to surgically get rid of it. Here's one on the floor of the mouth. You'd pretty well know what it is because why?
The color.
Yellow.
The color. Yeah. Here's another one in the palate. Remember we said that sometimes on the notes here it says you can see the blood vessels on the surface, which you don't see on other things. You don't see that on a fibromas. So that's how, sometimes that's how you tell it from the fibroma. So if histology, look, it's lipoid tissue, fat cells. And here's a huge one. This is the biggest one I've ever
Oh
seen.
my
Wow.
god.
Did she not show you this in class?
No.
You've
It's the
never
first
seen
time.
it before?
No.
That looks like
This was a young gal who came in.
How
And,
that guy eat?
That's why I asked her, how do you eat?
Chew, yeah.
Well, she didn't have any molars, so I asked her that question. How do you eat? Well, she could put it in the buccal vestibule, or because she didn't have any tongue, she could flip it back there and keep it out of the way. So I asked her, don't you want to get rid of it? Yeah, she thought it was time to get rid of it. like you say, and here's my term. This is what you call chewing the fat. You've heard the term chewing the fat?
No.
You've never heard the term chewing the fat?
Never.
Oh, come on.
Is it like eating junk food?
Ew.
No.
I don't chew fat. I don't like
We're
fat.
chewing the fat right now. All of us.
No.
I heard talking.
You've never heard that term.
No.
Never chewing the fat. I've
No.
never, never heard chewing the fat.
Chewing the fat is sitting around talking.
Oh, chewing.
Ah.
So if people who sit around talking, that's referred to as
That's a slang.
slang.
Got
Chewing,
it.
yeah, we've been chewing the fat. So this is a true chewing the fat. This is really a true chewing
Yes,
the fat.
that's a true one.
Yeah. I read something that, any of you know who Will Rogers was?
No.
Will Rogers?
I heard that, but I don't know.
Will Rogers lived back in the 1800s, early 1900s. This guy had a lot of philosophy. In fact, there's a real Will Rogers park somewhere, I think, out by the beach. He's very famous. But I read one of his quotes today. Never slap a person in the face who chews tobacco. I thought that was pretty good. Don't slap somebody in the face, in the
Slap
cheek.
means like this?
Yeah, don't slap somebody in the cheek who chews tobacco. Why? The tobacco will come out, you get tobacco juice all over you.
That's so true.
Yeah.
That's so true.
That is funny.
You know,
They think different way.
something that I think I don't. A jewel. J-U-U-L. What's a jewel?
Jewelry?
No, J-U-U-L. Come on.
It's like the smoking
Yes.
tobacco.
You ever seen one?
Yeah, they look like flashbacks. They
Yes.
were showing us in class.
Who showed you?
In class, we had a tobacco sensation
Yeah.
lecture, and
Yeah,
they were
good.
showing us that.
Yes, they showed you that?
Yeah.
Good. Do you know, they've only been out, I was reading about it last night because I'm working for my course in a couple of weeks on Sunday.
Yeah.
Do you know that Philip Morris Company paid, two guys started this in San Francisco. Juuls of all e-cigarettes, Juuls are 76% of them right now. Philip Morris Company bought 35% of the company that two guys started for $18 billion.
Oh.
Wow.
Wow.
I mean, unbelievable.
That's crazy.
Unbelievable. I mean, people are smoking these things like you cannot believe.
Yeah, and it's the younger generation.
It's
too.
younger. And smoking, if you pack one of those, you have as much nicotine as in a pack of cigarettes.
That's what they were telling
They
us.
told you
Yeah.
that?
And the thing is, with those fuels, it's like, I guess kids like it because it's like you can smoke it really quick and it goes away. Like, it's not like
It
cigarette,
doesn't have
you can't-
vapor. Doesn't have vapor come out,
Oh, it
right?
doesn't? Yeah, it does.
Well, I thought
Yeah.
read that thing.
Oh,
You
I
don't
don't
see the
know.
vapor. Who gave the lecture?
What's his name? He comes here every year.
Every year, yeah.
And
Chubby guy?
yeah.
Chubby guy?
He's a chubby guy.
Yeah.
A dentist?
No,
No,
it was not Dennis.
I forgot what his name is.
Yeah.
But he comes every year and leaves us lunch.
Does what?
He gives us lunch. Gives the whole class lunch.
Who is this guy?
I have no idea.
Did he give us
Who?
lunch?
Which class to teach it in?
Education.
He's like a guest
Who
speaker.
teaches the education class?
Miss Loomis.
Who?
Miss Loomis.
She's new.
She's new, yeah. It's the first quarter or second quarter.
Yeah.
She's here.
Does she teach smoking cessation?
Mhm.
She brought that guy to talk about that stuff. She
Yeah,
did.
I'd like to know more about it because I'm lecturing Sunday a little bit into it.
Oh,
did
that
they
guy
give you a
knows lots
handout
of-
or anything?
Yeah,
they
he
gave
did.
us a lecture PowerPoint.
They
Yes.
did?
Yeah, we have
We
it.
can give it to you.
Yeah, we
Oh,
have
I'd
it.
love to see
Yeah.
it.
That was a good one.
Do you have it, Sarah?
You should go to Canvas and then go to education, I think. She said she put it there. Education and then module.
Yeah, he was explaining all the stats of like smoking and like, all the effects of smoking, and then he like brought up Juul.
Alright.
Yeah. So it was really
So
interesting.
Loomis is
Miss Loomis.
Loomis.
Loomis. Which one is it? Tobacco cessation? This guy? PDF?
Yeah, let's see that one.
You know,
It's this one.
they're
Yeah, no.
they hired 250 new people every month for this company.
That-
250
Wow.
a month. That's how fast
It's
this
not
is
this,
growing.
is it? The
Wow.
guy didn't show us this.
This is something. Oh wait, we go up.
This is Jules?
So was this guy?
Vaping.
Like he works for the company.
But that's new. She put that stuff here, not him. Did he?
I don't think.
No, that's not his stuff. I think. I don't know. Is it? Do you remember?
Are you checking modules?
Yes. Is that the same thing that he gave it to us? Or Loomis gave it to us?
Does she work?
Yeah,
Is she here
it's-
every day, Loomis? I don't know.
No, not every day.
She's here
But-
today.
She is?
Yeah, I think so. Because we have clinic, so she's gonna be here.
Okay. But is she young?
Yeah, 40 something.
Okay.
Yeah, 40 something.
So she's
tall, black, yes, black hair.
Right.
I think she's Spanish.
Spanish?
Yes, she knows Spanish. So, Loomis.
All right. If I see if I can get the handout from her or
Yeah.
something, or I may ask you guys to bring it. If I brought up.
That guy
Sometime
knew
tomorrow
more
you
than
could-
her.
Huh?
The person that he came, he knew lots
Yeah.
of stuff.
Who used to teach that was
Education.
and she retired.
Miss Armstrong.
No,
Not
not
Armstrong, the other one.
The-
White skin. We had her
Uh,
first quarter. Chubby.
Yes.
Yes.
Oh,
Yeah.
oh.
Zos-
Zawistowski. Not Zawistowski.
No,
no.
Zeke.
Uh,
The other
uh,
one.
Yeah, I know who you're talking about.
Yeah.
Her dad was sick in the has a
Yeah.
cancer.
Right. Oh yeah.
Yeah.
Her what?
Her daughter.
Her daughter, her dad,
Yeah, her
all
daughter
Miss
cancer
Witt.
in the
Cancer.
hospital.
Miss Witt.
Miss Witt.
Yeah.
Miss Witt.
Miss Witt. No,
No.
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 Who was
What
it?
wasn't teaching? No. What I'm talking about, and she taught with me the smoking stuff. And she's taking care of her grandkids right now. She retired.
Yes. Yeah.
Her daughter is a physician, obstetrician.
Oh.
But Miss Witt too, taking
Whit-
care of
no,
the
Whit
grand
maybe. Okay. But
granddaughter at LA,
oh,
Los
come on.
Angeles.
oh, how can I forget? Her office was right there, here for years. Okay, let's keep going. Okay, I'm glad I asked you that. Okay. So, any more information on this? Okay, uncommon neural cavity, slow growing, yellow, soft. Okay, it's not firm. That one way you can tell a fibroma from a lipoma. Fibromas are firm, lipoma is soft.
Mm-hmm.
Okay,
Oh, I found the PowerPoint.
well, you
Did
did.
you find it?
Yeah.
Oh, here you go. That's
Yeah.
this one, not the other
Show
one.
it to me quick.
Yeah.
So it's strive to quit.
So that's a commercial PowerPoint or one he put together?
I'm not sure if it was a commercial PowerPoint.
Uh-huh.
I don't think he did this. Maybe he did.
Does this have jewels in it?
Let me see. I remember him talking about. It shows the demographics of smoking. What are the consequences?
What I'm looking just mainly is for e-cigarettes.
E-cigarettes. Let me see.
Did they talk about snus?
I think so. No. What is this news?
Yeah.
Snus is a chewing tobacco that's,
It says
Oh, yeah.
something
You
about
did talk.
e-cigarettes right there.
He did.
all right. 10 billion, look at that. $10 billion, unbelievable.
E-cigarettes are safer alternative. Potential harm to food in public. Known to explode or cause
And
fire.
Yeah, I see some people really exploded in their mouth.
Let's
All right, we gotta keep going. All right, neuromelanoma, not common, all right? Okay,
Oh, that's the same as schwannoma.
same thing as schwannoma.
Those are the same?
Yes, it
But we
is,
have two category for them.
yeah.
No?
Schwannoma is a neuromelanoma. Yeah. So I'm on page 10, right?
yeah.
Okay, not common, okay? It's an other name, neuromelanoma, okay? uncommon, benign neural neoplasm from swan cell origin. So they're going to look like a fibroma. And you only would know the difference. I mean, if I showed you that picture on the left-hand side, you're not going to say a schwannoma. You're going to say a fibroma.
Yeah.
You'd only know the difference by histology. Okay? Posterior mandible, most common on the tongue, so 25 to 48% occur in head and neck region. Slow growing. And they have this Antonia A and Antonia B. They're never going to ask you this. This is a histology. What they mean by this, see how this tissue, wow, that doesn't help you when you do this. See how this tissue lines, see how the cells line up in the middle? See how it's very, lines up?
Mm-hmm.
This is called verrucate bodies. I mean, this is very characteristic of a neural tumor, the way all this lines up here. But you're not going to. Nodular painless mass, uncommon in the oral cavity, slow growing, tongue most common intraoral site, tumor from the sheath of Schwann. They have verrucate bodies, Antonia A and Antonia B, and she wrote that down there. If you see Antonia A, Antonia B, it's a microscopic diagnosis, don't worry about it.
Mm-hmm.
Now here's neurofibroma. All right. So neurofibromas can be singular, all right, rising from Schwann cells and peripheral fibroblasts. So it's both. It's nerve and fibroblasts, okay? It's a combination. The name, neurofibroma. Does that make sense? Okay? Young adults, soft. You can have single ones on the tongue, slow growing, solitary. Okay, see under features where I am, it's solitary, or can be a component of neurofibromatosis, which is a genetically inherited disorder called von Recklinghausen's disease of the skin. I don't know why they didn't put that there. Rarely occurs in bone. And some patients, you'll get a patient sometime in your life, they have neurofibromas all over their body.
Oh wow.
I go to church,
Yeah.
somewhere there's a gal in there that has these, and she has neurofibromas. And I have a good friend who has this.
Yeah.
She's had this all her life. Right? I just talked to her on the phone here recently.
Yeah, I think a kid in my high school had.
Really?
Because he had like bumps.
Yeah, I remember. Yep.
So I'm guessing that was
Yeah, it's
neurofibroma.
not that uncommon. It's not a fun disease. And one thing about them, they also have, and she'll put this some, I hope, in here. Does she put cafe au lait spots? No, why not? Oh, that's an important thing here. They also have these are cafe au lait spots. What does cafe au lait mean? Cream and coffee.
Oh.
So you have these things like this. Now, the bad thing about this disease, and it's the very last thing, some of these neurofibromas can turn into a malignancy, a neurosarcoma. Okay? So that's, and that's about somewhere like 5 or 8% of the people that have this syndrome, then they can turn into that. But here's a couple of neurofibromas too.
Oh, look at these.
Oh my goodness.
So what happened to his eye? It's gone?
Yeah, I don't know what, somebody just gave me that picture.
Oh.
They worked in the mission fields.
Wow.
But that patient on the left, typical of neurofibromatosis. Hereditary disease in some cases, 1 in 3,000 patients, so it's not that uncommon.
Yeah.
So it can be single. Now, if you're single, you don't have the syndrome. But if you have multiple ones, you have the syndrome. Skin and oral mucosa, multiple lesions, elevated nodular masses, maybe in bone, arrive from Schwann cells, fibroblasts, perineural cells. So from nerve tissue and fibrous tissue. Okay, did she put amputation neuroma in here?
No.
Oh.
Oh, I'm surprised. Oh, okay. Hemangioma, we've had those before. So we'll skip that. What's our next one here?
Granular cell tumor.
Oh, granular cell tumor?
Yes.
Okay, I'll find that. We did this. We've had lymphangiomas. You know what? I got this picture because I didn't
That
have
was
a good
our
picture of
class,
leiomyoma.
1176.
Yes, So I
Yes.
told these gals, look like how you act when I give a lecture, so they were putting on their makeup.
Look at their phone.
Yeah.
Oh, it's like an old
Yeah.
phone.
Yes.
Oh, old phone?
Yeah,
Oh,
it's
yeah.
an old one.
Yeah.
Yeah.
Rabbit, I took a picture of this because the rabbit, that's a, okay, here's granular cell tumor. Oh, we had that today, yeah.
On the
Yeah.
quiz.
Okay, so let's look at the notes on that. Okay. Uncommon, really uncommon. Benign soft tissue neoplasm. It's a true neoplasm, right? Right from neural tissue, Schwann cells. All right. If you look at an old path book, it's going to say granular cell myoblastoma. What does myo mean? Muscle. So they got rid of that name. They put tumor. Okay. Sessile nodular mass looks just like a fibroma. Okay. More common in females, which is twice as common. You notice females have most of these diseases. You notice that? Predilection for the oral cavity and skin, but mainly on the tongue. Large eosinophilic cells, simple excision. You know, if you put fibroma for this, I wouldn't mark you wrong. No way I'd know. Here's a couple. Well, hey, is this the one you had in the quiz? No.
Yeah.
Yes.
It is?
That's
It looks like
yeah,
it.
on the quiz.
And something she didn't put here. Oh yeah, this is important. Under histopathic features, see this term here, pseudoepitheliomatous hyperplasia? Do you remember anything about that? What happens? For some reason, the epithelium proliferates in these things. Okay? It's not a tumor of the epithelium, it's down to connective tissue. But you get a proliferation of epithelium, and look at this epithelium here. It looks like, if I show this, now if I just showed you this picture and asked you what that was, what would you say? What is that epithelium doing?
It's like getting
Getting what?
thicker.
But it's also going where?
Down to connective tissue.
It's going into
Attached.
connective
Yeah,
tissue.
attached.
What happens when an epithelium goes down and invades connective tissue? What do we call it? Squamous cell carcinoma. But this is not. These cells are not dysplastic. Okay? So look at the name. Pseudo-fault. Pseudoepitheliomatous hyperplasia. So you get proliferation of epithelium that on a low power of the microscope, it looks like invading squamous cell carcinoma. But it's not. These cells are benign. So, in fact, if you read some old textbooks and old stuff, if somebody did a biopsy in one of these and didn't go deep enough, and they saw these cells that look like this,
Yeah.
I've read that people got part of their tongue removed because they thought it was malignant. This is totally a benign lesion.
Yeah.
Because, so what's this Mary Poppins? Pseudo, she sings this song, something lot of doses.
Oh yeah.
Yes.
Yeah.
So pseudoepitheliomatous. Okay, right? You see what I'm talking about?
Yeah.
Yeah, that would make a good.
Yeah. Yeah.
That would
Just
be
to
part of
remember
this.
it.
Yes,
Yeah.
right. Yeah.
Okay.
So I always think of Mary Poppins. This is a Mary Poppins epithelium. Yeah. Yeah. Sarah has no idea what.
No idea. Yes, exactly. No idea what you're talking about.
She never saw. What's the name of that?
Mary
Oh,
Poppins.
Mary Poppins was the
Yeah.
name of it?
Yeah.
You don't know the song from Mary Poppins?
I don't know who's Mary Poppins.
Oh man, you're just out of it. You know, you gotta get educated here.
Of course.
Huh?
That's why I'm here.
You better marry an American so you can get educated.
I've never had a chance someone ask me with the blue eyes or white skin. No, in these 6 years.
Okay.
No.
How can a
they-
beautiful woman like you?
They do like it. They like they like a blonde girl, or
No.
the boys from my country. They like blonde. They don't like darker skin or dark hair. They like blonde.
Oh, I like darkers.
I like
That's the
darkers.
opposite.
Yeah, I like
Yeah.
darkers. I like darker boy, darker girl.
Yeah. Yeah. Okay, but when you're out of school, go rent the movie Mary Poppins.
Very fun.
And there's a song that will get in your mind
Super.
that will just keep going, going, going. Right? Heidi?
Yeah.
Right.
Yeah.
Yeah.
For
Okay.
sure.
Beautiful song.
Beautiful song.
Who played in that movie?
Oh, what's her name? She was from Princess Diary.
Oh, okay.
How do I forget? She's really popular though.
Yeah. Hey, do you know who? I think Hank. Tom. You know who Tom Hanks is?
Mhm.
Yes.
I worked with him on a movie.
What? Really?
Yeah. Worked with him for 2 days.
Wow.
Yeah.
That's cool.
So
What did you do?
It was a movie called The Thing You Do. He wrote
Oh.
that movie and directed it.
Oh.
So I went in LA and he's a nice guy, really a nice guy.
Oh.
So I was, because I have antique, I'm ahead of the dental antiques here. And they rented some of our dental antique stuff from the school. So they came to see me and then they asked me if I'd go help on theirs. They had a dental office in the movie. They worked 2 days and so I went in. That's my only fame. You know.
Oh, that's pretty cool.
Okay, what's your next one?
The next one is hemangioma and
Hemangioma and vascular
malformations.
formations.
Okay, but didn't we have hemangiomas before? No?
We have it.
No.
We-
Okay,
Yeah.
so hemangioma, let's go back. Wait, let's go back from the hemangiomas. Oh, we had it here though. Okay, where's hemangioma? Oh, here we go. Okay, right here.
Yes.
Okay, here's hemangioma. So, how many of you have hemangiomas on your skin? No?
No.
Very common. Okay? A lot of them are in the head and neck region, hemangiomas. Okay? Nowadays, we call them vascular tumors, what we call them. So it's a hemangioma of infancy. You can have congenital. A lot of kids are born with hemangiomas. Okay? A lot of people have them on their face. I have a friend who has a big hemangioma on her
Right
cheek,
there.
a gal. Yeah. But a lot of hemangiomas when you're born with them will go away after a while. Some don't. But some people get them later on in life. And a lot of times they're on the face that look like this. See this here?
Yeah.
Or on the lips. Sometimes they be more red, but usually they're bluish, right? So it's a vascular malformation. They can be capillary, venous, or lymphatic. Okay, that just depends how many vessels, what they're from. Definition: hemangioma is a benign tumor of infancy, rapid growth phase, endoepithelial cell proliferation, followed a gradual involution. So they kind of disappear after a while. Where a vascular malformation is structure abnormalities of blood vessels with normal endoepithelial cells. So we kind of use the term hemangioma now for everything. But when you try to get the definition, there is a difference between hemangiomas and vascular malformation. So the clinical features. Most hemangiomas occur the first 8 weeks of life. More than 50% of hemangiomas occur in the head and neck region. So they're common there. Most common intraoral location is the tongue. I'm going to show you some big ones on the tongue. Okay? More common in girls and boys. Growth phase, they rapidly grow. All right? And then tumor grows proportionally with the child, followed by involution. In other words, they kind of disappear. They actually resolve within 5 years sometimes, or 9 years. So you're born with this and you go away. A vascular formation, present at birth and persists throughout life. They can be categorized per the type. Can be a capillary, venous. Sometimes when you have this whole thing, a hemangioma on the side of your face, they call it a port wine stain. Blood flow, venous formation, blue, easily compressible, may be present at birth and grow proportion with the patient. May show secondary thrombosis formation. Anyway, it's kind of hard you can't really tell the difference looking at them. But we just call them all hemangiomas. Here's some more. Look at this. Here's what they look like in the mouth. Oh, see? And here's one on the lip. And how do you tell? You push on it. When you push on it, there's a term. What is that term called when it blanches?
I thought it was
Blanching?
blanching.
Yeah,
Yeah.
but just, does she have it here? It's called dioscopy.
Oh.
You see the term at all in here? How do you treat these things? If a small one, you cut out the whole thing. You would never do an incisional biopsy in a hemangioma.
Mm-hmm.
Why?
Bleeding?
Yeah.
Make it more bigger.
How are you going to stop the bleeding? Right.
Oh.
So hemangiomas can be in bone also. And hemangiomas, if you have a radiolucency around the tooth, a lot of times you want to do a needle biopsy to make that is a hemangioma. If you extracted hemangioma that was in, but they can be in soft tissue and bone, okay? If you extracted a tooth that was in hemangioma, you may have a massive bleeding problem that you can't stop. So dioscopy is, look, how do I know it's hemangioma? I pushed on it with a glass slide, you know, a microscopic slide. So it blanched, and so it disappeared. So I knew it's hemangioma. I don't have to do anything with it. So that's how you make the diagnosis. You push on it, it will blanch. What are you doing? You're pushing all the blood out of it.
Yeah.
And you take your finger away, and once it fills back up again. So they're filled with blood vessels. So all these vascular spaces that you see right here, see this, all right?
Yeah.
Well, here they're filled with red blood cells. When they process, the red cells came out of these little spaces. But normally these spaces are filled with blood, just like your red blood cells, like here, okay? And look at this gingival tissue. All this is a hemangioma. Now, do you want to go scale that? No.
No, it's gonna be lots of blood.
You have to, you can cause
Yeah.
a problem. And here's the hemangioma in the tongue. Here's one in the soft palate. Here's a huge one on a young girl that came in that I took a picture of.
And is there pain?
No pain whatsoever. Nope. They chose, she went to see sometimes they can get rid of these by surgical excision, or sometimes in hemangioma they can inject some solution in there that will make it undergo like a thrombus. It will form and go away. This one they chose not to do. The bad thing on this gal, what if she was just sitting here and somebody came and bumped her with their elbow and she bit it? Man, you would have a massive bleeding problem. Yeah. Okay, proliferation of blood cells, common, or it's called a vascular formation too, malformation, right? There is a slight difference between the hemangioma and a vascular formation, and she talks about that here. I'm used to just calling them all hemangioma. They may be congenital, so a lot of them are there at birth, but early on they may go away. They may not either. Some of them don't occur till later on in life. A lot of older patients, you'll see them on the lip. You ask how long it's been there. Oh, the last 3 years. Form. Well, you push on it and it blanches. Well, if you want to get rid of it, you do an excisional biopsy. You know, some people don't like the looks of it. No. Common in the head and neck. 50% occur in the head and neck. Maybe in bone. Remember I said you don't want to extract a tooth that's in bone. Flat or raised, capillary or cavernous. This dioscopy, see that word? Means that you're pressing on it to make it blanch. You never do an incisional biopsy. Does that make sense?
Yes.
So what's the difference between incisional and excisional?
Excisional, you cut the whole thing out in one piece.
Oh.
Okay.
Incisional, you're taking a piece of it to put it on the microscope to see what it is. So if a lesion is small, you like to do an excisional biopsy. If you got a big lesion, you don't want to take it out until you can find out what it is to know how to treat it. So you do an incisional biopsy.
So with this one, you would do a non-incisional?
This one on the tongue?
Yeah.
I don't, you couldn't do an incisional biopsy. How are you going to take that out on an excisional biopsy?
Yeah.
That's tough. There are things that you can go and inject solutions in them, and over a period of time, it will undergo thrombosis and kind of go away.
Okay.
Yeah. I mean, the gal that I know, in fact, her husband was a dental student here, and she's in our church. She has a big one on her cheek, and I know some days you can see it a lot, other days you can't. So it comes and goes. She's a beautiful gal, and You know, to me, it isn't. I look at it and like it, but probably she doesn't like it. I mean, I know what it is, but I kind of feel sorry for her in a way. But I mean, I don't think it bothers her that much, but she'd rather not having this big blue
Yes.
area on
Oh,
her
yeah,
face.
that's all itchy.
Okay. Oh, what's the next thing on our notes? What time do you guys have to be in class? 9?
10 o'clock?
10.
So what time is class over? Quarter 10 to? What time does class start?
At
10.
Class starts at 10?
10.
So breaks are at 10 to all the time?
Kind of, yeah. Or we could do 5 too.
Yeah.
So is the class right next door?
Mhm.
Yeah,
Yeah.
down the hall.
Right. So,
Lymphatic malformations. It's the next one.
or what? Oh,
Lymphatic
okay.
malformations.
That's also called a lymphangioma.
Mhm.
Okay, all right? And let's look at those. So, the only difference between hemangioma and a lymphangioma or a lymphatic malformation is that now you have these vessels filled with lymph fluid instead of red blood cells.
Mm.
They're still lined by endothelial tissue. They're not as red, they're more pinkish. They're not as common. They do occur in head and neck region, all right? And a lot of times they have little tiny, they can be little tiny areas. It's not a true neoplasm, all right? And in the oral cavity, most of them occur on the tongue, and they can be a reason for a large tongue. And a lot of times on the tongue, if they're on the side of the tongue has a papillary surface to it. Okay, and let me show you some pictures. So here's some pictures. All right, look at this. Which one in here is lymphangioma and what one's hemangioma?
Oh, for sure.
All the blue one is hemangioma.
This is hemangiomas. This is lymphangiomas. All right? This is lymphangiomas. This is hemangiomas.
Yeah.
Sometimes they occur together. All right?
Oh, really?
Yeah. This is a patient, one of my own patients in private practice. Look how large the tongue is here. This is because he has a huge lympangioma in there.
Yeah.
Okay? Or, and then a lot of times you get a papillary look to it. I don't know why that happens. So I have a bet. Oh, so now we have. If I showed you histology, let's say I showed you something. I said, okay, tell me, give me a differential, and it looked like a vascular lesion. You could put lymphangioma or hemangioma.
Yeah.
Then if I showed you this histology picture, this is what I'd do. You would know it's lymphangioma because now these spaces are filled with eosinophilic lymph fluid, not red blood cells. If this was filled with red blood cells, you would say hemangioma. But it's filled with lymph fluid, so it's a lymphangioma.
Yes.
Does that make sense?
Yes.
Yeah. And they look a little different. Hemangiomas are more blue, lymphangiomas are more pink. Okay, let's look at this. May be present at birth, colorless or pink. Tongue intraoral is the most common area. Most all of them we looked at were the tongue, right? Tongue may be papillary. We didn't see that too. Cystic hygroma, don't worry about that. So, endothelial spaces contain lymph fluid, not red blood cells. So both of these are lined by endothelium. They're vascular channels. Okay. Okay, we had granular cell tumor. What's the next one?
Kaposi sarcoma.
Sarcoma.
And what's after that? Nasolabial
It's a
cyst.
cyst.
You know what?
Nasolabial.
We're gonna quit because we're gonna talk about cysts tomorrow. And my cysts are under. I put cysts, these cysts under cysts, not under this.
Okay.
Oh,
Okay.
okay.
So you read your notes on Kaposi sarcoma. All right.
Okay.
And we will talk about that tomorrow. Now, do we have a quiz tomorrow?
Yeah.
Yes, 2 quizzes.
Yes.
Oh, what's the quiz on epithelial?
Epithelial and pigmented lesion
Oh,
is about
okay.
post one. Pre one is pulp and periapical lesions, jaw cyst.
Oh, okay. Oh, okay. All right. So you feel overwhelmed? I think you learned a lot today. I mean, I think you're getting.
Yeah.
I mean, you're coming up with the answers.
Yeah.
Yeah.
And we have exam next week. God help us.
these movie stars where the mothers paid thousands of dollars to have people come and take their exams for them.
I know.
Do you want to pay me to take your exam
Oh,
for you?
Oh,
yes.
wow.
Yeah, we would pay
How
you.
much?
How much
How
you
much?
want? How much you want?
Could I?
I'll take out a loan right now.
You know, something I
This
learned
course
yesterday
is
that I
so
don't
bad. I
understand.
don't like it.
I was talking to your radiology teacher. He says when he has to give an exam, he's not in the room.
Oh, that's true.
There's no way I had to give an exam. If he had one of my exams, I would be in the room.
Yeah.
I don't understand that.
Yeah, to ask questions or something.
Well, no, I want to answer your question.
Oh,
Yeah, no one answered.
No one does.
I didn't know the meaning of words, but no one answered. That's the rule of exam.
They
No
have
one
a
talk.
proctor.
I don't have a problem giving somebody the meaning of words like you weren't
No.
used to them.
Dr. Richards.
No, I don't have a
no.
problem with that.
I asked what the color of teal because she mentioned one of the things about the midterm
Yeah.
general. That was the color teal, and she asked is bilirubin or hemosiderin, something like that. And I didn't know teal is yellow or green. To make a decision, it's hemo or it's bilirubin. And no one said I got it wrong.
Oh,
No,
Yeah.
see, I wouldn't give you the answer, but I don't
Yeah.
have a problem telling the meaning
We
of
have
a
a
word.
final and the fifth floor.
So
They're coming. They help. If I ask what does it mean, they're gonna tell. But the
They will tell
teachers, no. Yeah. The
I
teachers,
mean, but why won't they let a teacher give an exam?
that's a good question.
in the final, they will not be there. They
I
won't.
don't understand it, because I can